Welcome to the first ever Rocket Rounds here at RVH. My name is Dr. Christopher Martin, and I am the Director and Chief of Critical Care, as well as the Director of Education here at the hospital. We usually did medical grand rounds once a month, where we'd meet in the auditorium, have pizza, have a great talk. But as this is 2020, COVID has changed things, we're changing to a video podcast format that hopefully people will enjoy and watch whenever they can. Our first guest today is Cameron Moore. Cameron is our physician assistant here at the Royal Victoria Regional Health Centre, and he works in the critical care unit with our intensive care team. So I'd like to welcome Cam.
Chris, thanks for having me. Happy to be here.
Perfect. We're going to start off by just defining, what is a PA and what is your role?
Yeah, so PAs are medical providers who practice medicine under the direction and supervision of a licensed physician. We are able to attain patient histories, perform physical exams, we can order investigations, we can consult specialists, we can communicate diagnosis to patients, and we can order medications or prescribe medications, all on behalf of our supervising physician. And really the idea behind a PA is to offload some of the more routine duties that sometimes take up a lot of time that fall onto a physician. And that ultimately allows a physician to spend more effort and time really on the decisions, the procedures, and on the patients who really require their expertise most. And that's becoming more and more important in our healthcare system that has more and more stress. It seems like it's growing exponentially recently.
Yeah, I can definitely attest to your role in making our care better in the ICU.
Yeah, it makes physicians more accessible to patients, and we're pretty proud of that.
Absolutely. Now, how did you become a physician assistant? What was your education, your background?
Yeah, and so across Canada, there are 4 PA programs. There's U of T, McMaster, University of Manitoba, as well as the Canadian Armed Forces. In Ontario, U of T and McMaster have a 2-year second entry undergrad program, just like med school, that's run through the Faculty of Medicine. And it's really a condensed version of med school with the idea that we graduate as generalists and can be placed in roles where we get on the job training from our supervisors to really fit and tailor our skills to where they're needed most and where we can have the biggest impact.
Wonderful. And we're seeing more and more physician assistants here at RVH, and as you see these teams of the physician assistants work so well and perform so highly, more and more are coming. Yeah. But how common are they in Canada?
Yeah, we're still pretty new. So right now there's about 700 PAs practicing in Canada, mostly focused in Ontario and Manitoba, but there's been uptake in New Brunswick, Alberta, and BC. And the majority work in emergency medicine and family medicine, but really there's a PA working in almost every specialty in healthcare. Here at RVH, we have our physician assistants in general surgery, orthopedic surgery, nephrology, internal medicine, and myself in critical care.
Yeah, and I can see that expanding more due to the value. We're going to talk about what you can do in terms of a physician assistant. So, what can you do in terms of labs, investigations, procedures?
Yeah, so we have the ability to help direct or order almost any investigation that the routine or average inpatient here at RVH would need. And this is done in 2 ways. We can take a directive or a verbal directive from a physician and then pass that order on to be co-implemented by pharmacists or nurses or any other staff member here. Or we can do it through a medical directive, which is an agreed upon document that's between the institution, the physicians, the PAs, and as well as the co-implementers like nurses and pharmacists to order specific tests for specific indications or patients. And these include laboratory investigations, CTs, X-rays, MRIs, ultrasounds, as well as our ability to order on the physician's behalf things like an NG tube, a PICC line to be inserted by interventional radiology, to consult other specialties or allied health. And again, all as directed by our physician.
Okay. How about procedures in terms of the, IVs? You mentioned NG tubes. What kind of procedures can you do? And what kind of procedures do you have to be supervised or have graded supervision for?
Yeah, and so the idea is that we work under delegated acts from our physician. So a licensed physician has the ability to perform controlled acts, and that means that they can do invasive procedures, they can communicate diagnosis, they can set fractured joints, etc. And the CPSO outlines how that physicians have the ability to delegate these acts to other providers to increase the efficiency and access to care. And that's how PAs function. And we are able to take these delegated acts in the specific circumstances and order them on behalf or perform them on behalf of the physician. And that can include procedures as well. Now that does depend on some very specific requirements, which are quite important. And that includes that the physician has made has a meaningful patient-physician relationship and really understands the context of the clinical scenario. That the physician has given the delegate the appropriate training and equipment to perform the task, and that the patient has consented to a delegate performing their task. And those need to be outlined in order for myself or any of the other physician assistants to function. And that's really going to depend on the PA-physician relationship across different specialties. And ultimately, it's the physician who's responsible for supervising these acts and being available to troubleshoot or, again, be responsible for what they delegate. And again, that's done through a direct order. I can be asked by a physician to do these things, or I can use the medical directive as outlined to perform these duties.
Yeah, and even the ICU, we were trained to do certain procedures in the ICU, and as you become very skilled at them, the degree or intensity of supervision has become less. But is that trust? Because we know that if you have an issue with a procedure or there is something that you can come to us and we would help out. So it definitely does. I say access to care is a great way of putting it because it frees up the time for us to focus on other care issues that allow the patient to do better.
Yeah. And our medical directives outline very specifically that really does depend on the training and competency of the PA, which is different for every PA, as well as the scope of the physician, which is, again, varies from physician to physician, and that needs to be assessed prior to performing an act.
Yeah, really, you shouldn't be asking the PA to do something you can't do.
That is correct.
Okay.
That is correct.
What about medications? What can you order, and what did the physician themselves have to actually write the order for?
Yeah. Again, when it comes to prescribing medications, we fit either taking a direct order from the physician that then we co-implement with a pharmacist and a nurse, for example, or we have a list of medications that have been outlined with specific dosages, frequencies, and indications as part of that medication directive document. And really, that includes the most commonly used medications that an inpatient here in the hospital would need. There is the exception of controlled substances, and that includes things like opioids and benzodiazepines, for example, in which case that the province says that physicians cannot delegate to a physician assistant. Now, that being said, a PA can go and see a patient, assess their need for these medications, and provide and document recommendations in this information for a physician to assess and either agree or disagree and co-sign an order, which is where we can be used in relation to these controlled substances.
Yeah, which is so exactly. So, you order Tylenol, it gets processed and given. You suggest a morphine or another narcotic. I, as a physician, have to co-sign that order. Similar to medical students in some institutions. Unlike a resident, though, residents can order all those medications because they have a resident license to do so. Yeah. Okay, so now the role of PAs here at RVH is expanding, but how do you see the role evolving both here at our hospital, but also across the province and in Canada?
Yeah, we're still relatively new, but there are PAs graduating, more PAs graduating every year, and we're being incorporated to more and more aspects of medicine. And there's evidence arising that's showing that the efficiencies, the improved accessibility to physician-directed care, the cost savings through our healthcare system. And this is becoming more and more important as more and more strain is put on our system. So there's a lot of work going on for advocacy and awareness for hospitals or institutions and for physicians of how we can be incorporated and used most effectively, and how we can also be implemented into the whole care team to really streamline how patients come into hospital, get their care, and are able to leave hospital healthier. And that's being done through awareness campaigns, as well as working with the province and other regulatory bodies for physicians, nurses, pharmacists, in terms of defining our title, regulating what a physician can do, having a registered or protective title, and having really a streamlined process for getting physicians involved in care to really reap these benefits.
Yeah, you've proven that you're a valuable member of our interprofessional team in the ICU. With you there, we are more efficient. We provide better care, better patient-family relationships, and more timely access to care. So I can definitely advocate and agree with all the things you've said. Now, if there's some staff that want to know more about the certain tasks that PAs in RVH can be delegated, or the medical directives under which they fall, how can they access that information?
Yeah, so our medical directives are located on the intranet, and they can, with a quick search, will pop up with PA medical directives, and that includes the investigations and consults and procedures that we could order, as well as also the medications and the indications and how we can order those things. And at the beginning of the document, it also outlines the specific requirements that need to be met for us to take a physician order or to implement these medical directives. And if there's any questions, that we are all over the hospital in surgery, medicine, ICU, nephrology, and we're happy to answer any questions and help clarify things. This is something we're very passionate about, and we want to be able to work with the whole team to provide these benefits and provide better care, more efficient care to our patients here.
Well, Cam, that's amazing. Thanks for all you do in the ICU, all you do for the hospital, and also for being the first guest on our Rocket Rounds.
It was a pleasure to be here. Thanks for having me, Chris.
Perfect. That's Chris Martin for Rocket Rounds. We'll see you next time.